This is Trevor. We're going to be working on him today. So, so your right knee hurts you. If you stand up and walk around a little bit, does it hurt right now while you're sitting there?
Hurts right now.
Hurts right now? Okay. Okay, so Trevor, on a how much does it hurt? If this hand is no pain at all, and this hand is the most pain it could possibly be, put your hand in there and tell me, show me how much pain it is. Can you do that?
A little bit.
It's a little bit. So
like
down
here?
low. So maybe about a 2, 0 to 10, about a 2. Okay.
Sure.
Okay, we'll put a 2 there. Okay, so the heart arrhythmia, you were saying that he was diagnosed with that how long ago?
When he was like 3, the doctor told me
When
she could hear it.
She could hear it, okay.
And that's all we've done. She said not to do any more till sports.
So when he gets older, all right. Okay.
Mm-hmm.
Well, what we'll do is we'll just check and see if there's anything that might be creating anything like that. And was there anything else? Right knee and the heart?
He said his throat hurt today, huh? But I think that's the same thing.
How's it feel right now?
Does your throat hurt right now?
Try swallowing right now and see how it feels.
Does your throat hurt? Yeah.
Okay.
Okay.
All right. So one more time, okay? If this is as much as it could possibly hurt, way up here it hurts really a lot.
Yeah.
Watch. Here it doesn't hurt at all, and here it hurts really a lot. Put your hand in there and show me how much it hurts.
Your throat.
So about here, somewhere in there.
Like here? Here?
Lower.
Yeah.
About in the middle.
Mhm.
Okay.
Okay.
We do the best we can here.
Sure.
Let's see. Let's call that sore throat. I think that'll work.
Yeah.
Show up better on
See,
our
that's a 5. Yeah.
data extraction. It'll show better. Sore throat will probably match up with other people's sore throats. So, okay, so that's about a 5. And the heart arrhythmia,
Yeah.
we don't really know. In a case where we really, in a case like this where we really don't know,
There's no
we don't know if there isn't any or if there is. So I think what we'll do is we'll just leave that one blank. So diagnose, that's the code for diagnosis, DXD, diagnosed with heart arrhythmia, where the heart beats unevenly at age 3. And then you crashed on your bike. When was that?
Only a few weeks ago.
A few weeks ago?
Yeah.
And you hurt your knee, but it still hurts?
Yeah.
Okay. Okay. And how long has your sore throat been going on?
Take this last few days, huh? This week.
So for a few days.
Mm-hmm.
Okay. So let's have a moment of silence and we'll ask for some help from upstairs, okay? What we're doing is we're asking Heavenly Father to help us to fix you, okay? So close your eyes. Okay, there we go. And you can ask Him too. Okay, there we go. We're good. Okay, so let's ask which of these 3 things your body would like to work on first. Your subconscious mind doesn't want to go to the right knee or the heart arrhythmia. Heart arrhythmia. Okay, so that means that there is something, going on there. Whether he actually has an arrhythmia right now or not, I don't know. We could put a stethoscope on him and test it, but that's going to be beyond the scope of most people. So that's okay. But the fact that his subconscious is saying yes, there's something about this I want to work on, then that means that there's something there we need to get rid of. So let's ask what this thing is. Is it on the right of our chart? No. Left of the chart? Yes. Is it some kind of energy? No. Is it toxicity? No. Is it circuitry? then yes, okay, is it an organ or a gland? Is it a chakra? Is it a disconnection? Is it a meridian? Okay, well, it's a meridian, so let's go to the meridians. And is it a meridian on the left side of this chart here? No, so it's right side. So let's just guess here. Is it the heart channel, pericardium channel? The pericardium is the outer lining of the heart, and that's the imbalance. That's where the imbalance is. So, okay, is there something deeper that is imbalancing this meridian? And the answer is yes. Okay, so sometimes the meridians just get a little off and they just need to get reset. You hit the reset button kind of by just going down the back a few times. But if there's something deeper that is actually creating the imbalance, then we want to know about that. And so generally speaking, anytime we have an organ that shows up as imbalanced, or a gland, or a chakra, or if there's a disconnection or a meridian imbalance, any of these things down in the circuitry area, if any of those show up, I always like to ask if there's an underlying reason, because often there is. So, what is this underlying reason that's imbalancing your pericardium meridian? Is it on the right side of our chart? No. So left side. Is it an energy? No. Is it toxicity? No. Is it some kind of an organ imbalance, or a gland imbalance, or a chakra imbalance? Okay, it's a chakra. So probably, which chakra? Probably the heart chakra. Not necessarily, but is that what it is? Yes. Okay, so let me make a couple of notes here. Heart arrhythmia due to, okay, pericardium meridian imbalance, and we can say that that was due, being created by, you can put a little dash and a greater than symbol, and you can use that to signify that this imbalance is being caused by this other thing. And so let's see what we found there. We found heart chakra imbalance. So we'll just say heart chakra, and we'll know that it's imbalanced. Is there an underlying reason for the heart chakra to be imbalanced? Yes, there is. Wow. So see, sometimes you'll get a chain of things going on. And so the easiest way to signify those is to just put a dash and then a greater than symbol. So pericardium meridian imbalance is being caused by a heart chakra imbalance, which is being caused by something else. And hopefully that'll be the end of the road. What's causing this heart chakra imbalance? Is it something on the right side of the chart? No. Is it left side of the chart? Yes. So is it some kind of energy? Yes, it is. Is it emotional? Yes, it is. Okay. So what is it? Is it a trapped emotion? Is it a heart wall? He's got a heart wall.
Oh my God.
we could have just asked for that.
Yeah.
It would have been easier probably, but that's okay. He's got a heart chakra, and that's due to heart wall. Heart chakra imbalance due to the heart wall. Okay, so...
Are you tired now? Yeah. Okay, sit up. Sit up for a minute. Sit right here. There we go. I'm going to go to sleep.
And we can just abbreviate for heart wall emotions and just put a HW. And this first heart wall emotion, is it in, can we release an emotion from your heart wall first? Yes. Is it in column A? No. Column B? Yes. Is it in one of the odd rows or an even row? Even row. Is it in row 2 or is it in row 4? Yes. Is it depression? Is it frustration? Is it indecisiveness? Is it panic? Is it taken for granted? Those are all weak. And you know what that means? It means it's inherited. And is this inherited? Yes. Okay, so this inherited emotion, is it inherited depression? Is it inherited frustration? Or inherited indecisiveness? Or inherited panic? It's an inherited emotion of panic.
Okay.
And we can abbreviate inherited also by just putting INH. Inherited panic, and this came from, did you get this from your mother? No, it came from Dad. Okay. And did he get it from anybody earlier? No. Do we need to know more about this? No, we don't. Okay, so let's release this. You ready?
You gotta sit up.
We're going to run the magnet down your back. Here we go. 1, 2, 3. We'll give you one more just for fun. Then we'll tickle you right here. Okay, so let's ask if we release that. inherited panic that you got from your dad? Yes. And did that also release from your dad? And the answer is yes. Okay, awesome.
Okay.
So, do you still have a heart wall? Yeah, he does. So this, can we clear another emotion? Yes. Is it in column B? No. Is it in column A? Then yes. Okay, is it in one of the odd rows? Is it in row 1 or row 3? Row 3. Is the emotion crying or is it discouragement? It's discouragement. Okay. And so we'll put HW again. HW, heart wall. Discouragement, do we need to know more about this? Not really. Okay. Is that an emotion that he, has to deal with sometimes? You noticed?
Like, on himself, sometimes he gets, discouraged easily. For sure.
You like that?
Yeah.
Okay. Discouragement. Did we clear that? Yes, we did. Okay. Do you still have a heart wall? No. Do you have a hidden heart wall? No. Okay.
Does your heart feel happy? Does it? Yeah. Okay.
Okay. Awesome. So that was the heart arrhythmia. Okay.
Okay.
Let's ask: is there? That was what was creating the heart arrhythmia. Let's ask: is there another underlying reason for the heart arrhythmia that we can work on now? And his body says no. Okay. So is there something? Is there something that we need to work on for the right knee, or do we need to go to the sore throat? Is there something else that we need to work on? Do you have something else we need to treat? Okay. Let's go back to our chart here. And when we're looking at this big chart here, let's ask: is there another underlying imbalance that you have on the right side of the left side? Is there anything else we can work on with you? No, he's done.
Nope. Okay.
So, boy, I'm glad we got that. Isn't that funny though, see?
A heart wall caused an actual arrhythmia.
Yeah, now see, as we were going, oh sure, well if you think about it, when you have well see, first of all, your body is nothing but energy. And so when you have a trapped emotion in that energy field or any other energetic imbalance, what it's doing is it's distorting your normal energy field of your body. And that's all your body is really, is energy. Mm-hmm. So when you distort that energy field of the body, you're ultimately distorting the tissues of the body themselves. And when you distort those tissues, who knows what's going to happen? I mean, all bets are off. You have no idea. Yeah. And that can result in cancer years down the road or, you name it. So in this case, his body says that was what was an underlying cause of his arrhythmia. Will that totally fix it? I don't know. Well,
when he goes to his kindergarten ticket.
Yeah.
Which says.
Mm-hmm. It wouldn't surprise me at all if that totally fixed it. Mm-hmm. I've seen that happen many times. So, okay, so it looks like we didn't need to work on anything else. So let's ask, hey, Trevor, how does your knee feel now? Can you feel your knee? Does it hurt still?
Does it feel better? Yeah.
Does it hurt at all? Okay, so I guess I'll call that a 0. The heart arrhythmia, again, we don't know.
Yeah.
So we'll just,
I
mean, we could put a number in there of some kind.
He says his throat feels better.
I guess we should put something in here for heart arrhythmia. We don't know how bad it is, so...
Well, it's a 10 for me for concern. I mean, I'm concerned about it, so I don't know if we want to...
Yeah, it's kind of it's hard one. It's a hard one to judge.
Yeah.
Where to put that one.
I don't know. Yeah. But she said it was a mild arrhythmia.
It was mild.
I mean, so
we'll call it a 3 since she said it was mild. Where it is now, we don't know. We'll call it a 3. Mm-hmm. If he were to go in, say tomorrow or next week, and get tested, and there's no arrhythmia, then we could say it's a 0. But we can't really say that now. But how does your throat feel? Swallow. Does it hurt now?
Does it feel better?
Does it feel better now, or does it still bother you? How does it feel?
Good.
Does it hurt?
No.
Okay.
Okay.
So we got that one, I guess, to a 0 as well.
Yeah, he's happy now.
All right, awesome. So that's how that works. Okay, thanks, Trevor. See you, buddy.
Thanks.
Okay. Thank you.
Okay, wave. Say bye.
Yep, say goodbye to everybody.